When you get sick, you go to the doctor. You pay a copay, you get a bill. But in that seemingly simple transaction, a colossal, largely invisible machine whirs to life. A machine that decides what your care is worth, which drugs you can get, and who ultimately profits from your illness. In the United States, one of the biggest operators of that machine is the Cigna Group. With over 190 million customer relationships globally, its influence is immense. But in early 2026, this healthcare giant is in the headlines for something far less abstract than insurance premiums: a massive data breach and a business model under intense scrutiny. This raises a critical question for every patient. Is your health insurer working for your health, or are you and your data just assets on a corporate balance sheet? Welcome to Health Inside, Anatomy and Science. Today, we're not dissecting a body, we're dissecting a corporation. We're going inside the anatomy of Cigna, how its dual structure of Cigna Healthcare and Evernorth creates a closed loop of profit, how its controversial AI algorithms have been accused of denying claims en masse, and what the 2026 data breach means for the security of your most private medical information. This is the science of the healthcare business. Part 1. The Corporate Anatomy, Cigna Healthcare versus Evernorth. To understand Cigna's power, you must understand its structure. It's not just an insurer, it's a vertically integrated healthcare ecosystem. Cigna Healthcare, the front door. This is the division you know. It sells insurance plans to employers, individuals, and Medicare beneficiaries. It collects premiums and pays claims. When you log into your MyCigna portal, this is the face you see. Evernorth Health Services, the engine room. This is where the real control and profit is generated. Evernorth is a collection of subsidiaries that manage every other aspect of your care, often owned by Cigna itself. Express Scripts, the largest pharmacy benefit manager, or PBM, in the U.S. It negotiates drug prices with manufacturers, decides which drugs are on your plan's formulary, covered list, and processes your pharmacy claims. Critics argue PBMs like Express Scripts create opaque rebate systems that can incentivize keeping list prices high. Accredo, a specialty pharmacy that mails high-cost drugs for complex conditions like cancer or rheumatoid arthritis directly to patients. This keeps this lucrative business inside the Cigna family. eviCore, a medical benefits management company. It reviews and pre-approves or denies referrals to specialists and authorization for procedures like MRIs or surgeries, using clinical guidelines and algorithms. The closed loop. A Cigna insurance member gets a prescription filled through Express Scripts or Evernorth, gets a specialty drug from Accredo or Evernorth, and needs pre-approval for an MRI from eviCore or Evernorth. Cigna controls the premium, the claim, the drug price, the pharmacy, and the gatekeeping. This creates enormous economies of scale and data control, but also raises profound questions about conflicts of interest and patient choice. Part 2. The Algorithmic Gatekeeper, the PXDX Controversy. In 2023, a shocking investigation by ProPublica and the Capital Forum revealed a system at the heart of modern insurance: algorithmic denial. The report alleged that Cigna doctors were using a system, internal company documents referred to it by codes like PXDX, to deny millions of claims in batches without reviewing individual patient files. Here's how it allegedly worked. A claim is submitted for a common, low-cost treatment, like a blood test. An algorithm flags it against a set of broad clinical policies. A Cigna physician, whose name is attached to the denial, can review hundreds of these flagged claims in minutes, simply ratifying the algorithm's decision. The patient or their doctor receives a denial. Cigna stated its system helps eliminate human error and ensure efficiency, but medical ethicists and physicians decried it as a rubber-stamped denial factory that prioritizes corporate efficiency over individualized patient care. This controversy is a landmark case in the rise of AI and automation in healthcare rationing, a trend every patient should be aware of in 2026. Part 3. The 2026 Data Breach, Your Health Data as a Commodity. In late 2025, Cigna announced a breach at one of its vendors. By January 2026, it had become a class action lawsuit. The exposed data reportedly included patient names, insurance identification numbers, and claims numbers. This isn't just about spam calls. Health data is the most valuable personal data on the black market. It contains immutable information, like your birth date, medical history, that can be used for medical identity theft. Fraudsters can get expensive medical treatments under your name, leaving you with ruined credit and corrupted medical records. Targeted scams and blackmail. Knowledge of a specific condition can be used for sophisticated phishing attacks or extortion. Insurance discrimination. While illegal, stolen data could theoretically be used to deny future coverage or employment. The breach underscores a terrifying reality. When you entrust a corporation with your deepest health secrets, you are also entrusting its entire digital infrastructure and that of all its vendors. Your health is now a data security risk. Part 4. Navigating the System, a Patient's Survival Guide for 2026. Faced with this complex system, how do you advocate for yourself? Here is a strategic guide. Understand the why behind a denial. If a claim or prior authorization is denied, don't accept the first no. Call and ask for the specific clinical rationale. Request a copy of the internal clinical policy used to make the decision. Appeal, appeal, appeal. Insurance denials have a formal appeals process. The first level is often internal. If that fails, you can request an external review by an independent third party, whose decision is usually binding to the insurer. Persistence pays. Leverage your doctor. Your doctor is your strongest ally. They can write a letter of medical necessity, providing detailed clinical evidence for why a denied treatment is essential for you, not just a generic patient. Audit your EOBs, explanations of benefits. Scrutinize every document. Look for errors in coding, duplicate charges, or services you didn't receive. The MyCigna portal is a tool for this. Ask about alternatives. If a branded drug is denied, ask your doctor and insurer, is there a generic or a therapeutically equivalent alternative on the formulary that is covered? Often the PBM, or Express Scripts, has a financial incentive to steer you to a different drug. The big picture, the financialization of health. Cigna's story is a microcosm of American healthcare. It highlights the tension between a public good, health, and a private, for-profit business. Key metrics for Wall Street, like the medical loss ratio, or MLR, which is the percentage of premium dollars spent on actual medical care, directly influence corporate behavior. A lower MLR means more profit. The rise of vertical integration, algorithmic gatekeeping, and data vulnerabilities forces us to ask, has the business of healthcare become disconnected from the practice of healing? The 2026 lawsuits and public scrutiny are a sign that patients, regulators, and lawmakers are beginning to demand more transparency, accountability, and perhaps a re-evaluation of first principles. The Cigna Group is not a monolith of evil. It is a rationally acting corporation in a complex, profit-driven system. But its scale and practices, from algorithmic denials to data breaches, have profound consequences for human health. As patients, we must understand that our medical journey is also a financial and data transaction. By learning the anatomy of our insurer, by knowing our rights to appeal, and by demanding transparency, we can begin to reassert that health outcomes, not just shareholder outcomes, must be the primary metric of success. If this corporate dissection of a healthcare giant gave you a new perspective on your insurance, please give this video a thumbs up. Knowledge is the first step to better advocacy. Share it. This is information every American needs. Subscribe to Health Inside, Anatomy and Science, and hit the bell.
We analyze the systems that shape your health from the cellular level to the corporate boardroom. Be informed, be persistent, and remember, you are more than a claim number.